Welcome to our presentation on opioids, led by Professor Yasin Tayem. Today, we will explore the classification, mechanisms, and effects of opioids, providing a comprehensive understanding of their role in medicine and potential for abuse. Opioids are classified based on their origin. Natural opioids, like morphine and codeine, are derived from the opium poppy. Semi-synthetic opioids, such as heroin and oxycodone, are modified opiates. Synthetic opioids, including fentanyl and methadone, are entirely synthetic, mimicking opiate properties. Opioids are also classified by their action on receptors. Strong agonists like morphine bind tightly, while weak agonists like codeine bind less strongly. Mixed agonist-antagonists, such as buprenorphine, and antagonists like naloxone play crucial roles in treatment and overdose management. Opioid receptors mediate various actions. The Mu receptor is key for analgesia and adverse effects like respiratory depression. Delta receptors influence hormonal disturbances, while kappa receptors are linked to dysphoria and hallucinations. Understanding these helps in managing therapeutic and adverse effects. Opioids work by binding to G-protein-coupled receptors, inhibiting adenylyl cyclase. This leads to postsynaptic potassium efflux and reduced presynaptic calcium influx, suppressing neuronal firing. Some opioids also block sodium channels, enhancing analgesic effects. Opioids are widely abused due to their euphoric effects leading to addiction. Drugs like morphine and heroin are particularly notorious for causing intense euphoria, making them highly addictive and a significant public health concern. Natural opioids, or opiates, include morphine and codeine. Morphine is a strong Mu receptor agonist, while codeine is less potent. These drugs are essential in pain management but require careful monitoring due to their addictive potential. Opioids are the strongest analgesics for severe pain, providing relief and a sense of well-being or euphoria. This dual effect makes them invaluable in medical settings but also poses a risk for misuse and addiction. Euphoria from opioids is linked to rapid tolerance, meaning users need higher doses to achieve the same effect. However, not all opioid actions develop tolerance, which is crucial in managing long-term opioid therapy. Opioids can cause life-threatening respiratory depression, making them effective antitussives for cough suppression. They also cause miosis, or pinpoint pupils, a classic sign of opioid use or overdose. Opioids can induce emesis, constipation, and relieve diarrhea. At high doses, they may cause hypotension and bradycardia. These effects necessitate careful dosing and monitoring in clinical use. Opioids can trigger histamine release, causing urticaria, and lead to hypogonadism. They may delay labor and cause hypothermia and immunosuppression, highlighting the need for cautious use in vulnerable populations. In emergencies, opioids are administered intravenously for immediate effect, such as in myocardial infarction. However, they cross the placenta, affecting the fetus, which requires careful consideration in pregnant patients. Morphine is the drug of choice for severe pain, such as myocardial infarction or cancer. Opioids also suppress dry cough and treat diarrhea, demonstrating their versatility in medical treatment. Opioids are used epidurally during labor to relieve pain, with remifentanil being common. If neonatal respiratory depression occurs, naloxone, an opioid antagonist, is administered to the newborn. In palliative care, opioids are essential for pain relief in terminal illnesses. Patient-controlled analgesia allows patients to manage their pain effectively, ensuring comfort in their final stages. Morphine is preferred for pulmonary edema due to its vasodilatory effects. Opioids like fentanyl and remifentanil are also used in anesthesia, highlighting their critical role in various medical procedures.